so you can hear what I say. Hello, everyone. I'm Bert Eichel, the health officer of Mobile County. It's good to be with you on this rainy day in Mobile, Alabama. COVID-19 is still a challenge for us in our community, but it seems that the community transmission rate is going in the correct direction. We're down from 31% of our tests being positive to 26% of our tests being positive. Our hospital admissions, we had a high point of 486, and we have 431 persons in the hospital today. We did not have anyone reported as dying in the past 24 hours. That is very, very good news. So for those of you who are taking us seriously, wearing your mask and getting vaccinated, thank you. You are really making a difference. But we still have a long ways to go. And I am very concerned that people are going to football games, not wearing a mask, yelling and socially being close, and that's going to increase opportunity for the Delta variant to infect people, even those who are fully vaccinated. So I've heard stories about people who have been fully vaccinated and yet they've still gotten COVID. That is to be expected on some cases. 90% of the people should be protected if you're fully vaccinated. But again, don't take unnecessary risk. Just because you have a seatbelt and airbags in your car, you need to be careful when you come to certain intersections. And if you're on the train track, the airbags and seatbelts are probably not going to be what they're advertised as being life-saving. So all of us need to be cautious for another 4 to 6 weeks as community transmission rates are starting to decline. We hope they'll get back down to the 5%. That's when we came back and the medical personnel said it's okay to take your mask off with community transmission rates less than 5%. So be careful as we approach the holiday weekend. Please use extra caution. Don't socialize with people you do not know their vaccine status without wearing a mask, and maintain some distance. And remember that you can make a difference, especially to yourself, to your immediate family, and to others. This is a critical time that we all need to work together in order to have the desired outcome. COVID will be defeated. We just don't want it to take any more lives or take any more of our hospital capacity at this time. I want to thank all the medical providers in Mobile County, the doctors, the nurses, the private practitioners, the academic medical centers. They're all working very hard, and you're doing a great job in saving lives. So thank you very much. And Dr. Murphy is going to talk about the FDA's approval of the Pfizer vaccine, fully approved. For those who have had questions about using it, we can rest assured that it's now fully approved. But Dr. Murphy will give you more information, and thank each and every one of you for what you're doing to make our community safer and better.
Thank you, Dr. Eichel. It's always a special treat when our health officer comes and gives us a pep talk and reminds us that we're not out of the woods yet, but it looks like we may be doing a bit better. So keep up the great work, everyone. So I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Monday, August 23rd. I'm here to give you the update of our COVID-19 pandemic as it affects Mobile County residents, visitors, and workers. The cumulative number of COVID-19 cases is now at 60,412. 291 cases were added yesterday. We'll talk a little bit more about how we do have a few indicators that are trending down. That 291 number, a month ago would have shocked me, but I'm pretty happy with it today that it looks like we are seeing a downward trend in the number of cases reported, though they are still at a record high. So our number died on the daily report sits at 970. Looks like we might have to check that report, Tommy, if you're watching, because our cumulative number is at 970 on the daily report, but on the weekly report, we're reporting slightly more than that. So we'll look into that and tell you tomorrow if we need to update some of those numbers. As Dr. Eichhold mentioned, the number of people in the hospital has gone down rather slightly for the past couple of days, but it's a good sign. 32 people were admitted to hospitals yesterday, and the number in the hospital was around 430. We have still been way above 400 for more than almost 3 weeks now, and our hospitals are still doing a phenomenal job trying to cope with what is just an unprecedented level number of people who are seeking treatment in our local hospitals. Just wanted to mention a couple of things about the demographics, and again, this is coming from our daily report. If you look at the number of cases that were reported in the last 14 days, it's split almost evenly between male and female, but if you look at the sex of people who have died, 70% of those are men. So please, if you are a male and you get COVID, please seek treatment early. Do not wait to seek medical care and put yourself in a position of maybe not being able to turn back a serious illness by putting off medical care or seeking treatment in a hospital. We're still seeing the large number of hospitalizations occurring in unvaccinated individuals. So it's about 85% on any given day. And of course, if we look at our pediatric patients that are hospitalized, it's 100% of those since they're not eligible for vaccination. So looking at the weekly expanded report, we are showing 3,025 cases reported to us last week. That is down by about 1,200 from the week before. It is still a record, still higher than anything we'd seen prior to August of 2021, but it does look like it is going down slightly, and we are really excited about that. It's just so crazy to me when I look at this chart showing the number of cases by month, that already in August, with still 7-8 days to go, we have over 11,171 cases reported to us, which we're going to more than double the number of cases in August than we saw in July. The 14-day average number of people admitted to a hospital on any given day has gone down quite a bit. It's now at 34. The percent of emergency department visits for COVID-like illness is down from a high of 20% down to 15%. And as Dr. Eichhold mentioned, the percent positive laboratory test is down around 26%. To put that in perspective, nationwide, it's still under 10%. But we still have, yes, we're going in the right direction. I'm really excited about that. But we are still seeing extraordinarily high levels of COVID transmissions, of hospitalizations and deaths in Mobile County. Last week, 34 people died with COVID-19. That was down slightly from the week before, so we will continue to monitor that closely. All right, schools are in pretty serious shape. We are hearing about lots of cases in schools and classrooms needing to shut down and some child cares needing to shut down. We will continue keeping a close eye on that. I wanted just to briefly talk about the one-pager that I mentioned last week, communicable disease chart for Alabama schools and child care facilities, exclusions and readmission criteria for COVID-19 cases and close contacts. Please, if you are a parent or if you work in a school, please print this and keep it handy, because interpreting this guidance sometimes gets really tricky. But the document talks about COVID-19 case exclusion, so exclusion for people who are diagnosed with COVID, about exclusion for COVID-19 contacts, close contacts, It talks about exposure notification. So when schools should notify parents of students who are close contacts. And then it has some guidance on when to exclude children from school or childcare and exceptions to exclusion. So lots of really important information in this document. Please have it handy. Superintendents, principals, please share this with your parents. Send it home with your students to keep this handy, because there is a lot of confusion and misinformation out there. Basically, if you have COVID, you stay at home for 10 days. If you are unvaccinated and you are exposed to someone with COVID, you stay at home from 14 days past the last date of your exposure. There are some very fine exclusions that apply, but they are not always easy to interpret and understand. So check the one pager, or send us an email to covid19@mchd.gov. Okay, Mark's saying that he just shared this on Facebook, so click on that link and bookmark it. All right. As Dr. Eichel mentioned, it's a really exciting day because early this morning the FDA approved the first COVID-19 vaccine. So this again is full FDA approval. It is for the Pfizer BioNTech COVID-19 vaccine that can now, be marketed as fully approved for individuals 16 ages and older. The vaccine continues to be available under emergency use authorization for adolescents who are 12 to 15 years of age, and for the administration of a third dose in moderately to severely immunocompromised individuals. So it's our hope that the FDA approval of the Pfizer vaccine will help some people move off the fence who are maybe waiting for that approval. A lot of people have told me that, well, it's not FDA approved, it's not FDA approved. Well, now it is. So please go out and get vaccinated. Or, come at me with what your new excuse is going to be for not getting vaccinated, and we'll talk about it. But we're just super thrilled that FDA felt that the information on the safety and the effectiveness of the Pfizer vaccine in people 16 and older warranted full approval. And I'm sure they will continue to monitor effectiveness and safety data for children 12 through 15 and for the Moderna and the J&J vaccines. So we're super excited about that. And hopefully a lot of you will decide to go out and get the vaccine now that it has received full FDA approval. All right, there are quite a few questions today, so let me see if I can get through them. Someone saying, am I encouraged by recent trends in hospitalizations decreasing, although slightly? Yeah, we're really excited to see just small improvements in the number of people hospitalized. It can mean a big improvement to hospitals and the staff that are treating those patients. So we would like to see larger reductions in the number of people hospitalized, but we will take the incremental improvements that we are seeing and hope that they continue. But again, we have to be very careful, because if with, the start of football season and Labor Day, we could backslide very easily if people don't continue to get vaccinated, wear a mask, and socially distance when they are in locations, when they're in crowds, when they're in social settings, that, when they're mixing with people that they don't know or don't know the vaccine status of. So we are encouraged, but still a bit hesitant to celebrate just yet. Let's see, a question about, as a public health official, was I discouraged by the booing that occurred during a political rally in North Alabama on Saturday? So I've heard about this. I did not see it, but I heard that when our former president encouraged the crowd to get vaccinated and mentioned that he and his family had been vaccinated, the crowd of supporters booed former President Trump. This is concerning because I think if President Trump cannot influence Trump Republicans to get vaccinated, I have very little hope of doing that as a public health official. So we just continue to try to have those conversations and try to understand, why people are hesitant. What is it about your personal beliefs in politics or media or healthcare or science that is keeping you from taking a life-saving, safe and effective vaccine? So we will continue on that very difficult but important mission of trying to encourage people to get vaccinated and to trust in the medical science and the advice of medical professionals to get vaccinated to protect yourself and your family. Let's see. I do think that FDA approval of the Pfizer vaccine, combined with the recommendation of a third dose for people who are moderately or severely immunocompromised, will lead to a slight uptick in receipt of vaccination. We saw that sort of anecdotally in our own vaccine clinics last week, where we had more of our vaccines were third doses than first or second. But I'm not overly optimistic that FDA approval is going to move us from 32% vaccine coverage to that 70% that we need. So we probably will see very small increases or very incremental increases in vaccine uptake, even though the FDA Pfizer vaccine is now fully approved by FDA. Let's see, what's my reaction to the FDA approval? I think I already answered that. A question, do I think companies will be more likely to mandate vaccine for their employees now that it is fully FDA approved? And I think the answer to that is yes. Many large corporations have said that as soon as it's approved, they will require vaccination. And the question goes on further to say, do I think that the Mobile County Health Department will mandate the COVID vaccine? That is not my decision to make. We have a very great team of executive decision makers with diverse perspectives on this. So we will be considering that. But I do think that you'll see many large employers and some healthcare facilities mandate the vaccine. And the National Healthcare Safety Network and CDC are still trying to work out whether or not or when they will require vaccine for employees at nursing homes. So more to come on this. There likely will be mandates and lawsuits and options for opting out of a mandatory vaccine. So I think everyone knows that this is not going to be an easy road with companies that begin mandating vaccination for their workers. All right, someone asking about that I've previously talked about the dangers of ivermectin, and over the weekend FDA again warned people not to take it. Again, I don't have any proof or examples of people who are self-medicating with ivermectin. I'm sure if they were, they would not tell me about it, but we do hear of adverse events. We hear of case reports out of other jurisdictions. So please, adhere to the FDA warnings, against the use of particularly agricultural or animal grade ivermectin for the treatment of COVID-19. Just don't do it. All right, let's see. When I talk about the number of cases reported, some people have had COVID multiple times. How does that impact the numbers of those who tested positive? So yeah, it gets a little tricky in public health when you have people who, get communicable diseases or infectious diseases more than once. And this is not unique to COVID. I mean, we have people who get syphilis more than once, who maybe get, salmonella more than once in their lifetime. The way we deal with this is by using what we call a surveillance case definition. For the situation for COVID, you are considered reinfected or a new case, and we count you again if you get COVID 90 days or greater past your first documented infection. So that's how we deal with that. So if you got it once on January 1st and then you're diagnosed again April 1st or later, then you will count as a second case of COVID-19. What are my thoughts about schools closing with high COVID exposures? We are going to see this continue to happen in schools, particularly in schools that don't have a mask mandate and that are not requiring children with COVID and children exposed to COVID to stay home. Those schools are going to continue to have potentially high levels of COVID transmission on their campuses, and it is going to lead to large numbers of students or large numbers of faculty, staff unable to report to school or work. What percentage of the population has been vaccinated? So in Mobile County, the numbers that I just looked at this morning, 32% of Mobile County residents are fully vaccinated for COVID. Of course, the numbers are much higher than that in the older populations. 72, 73% or more people who are 65 and over have been vaccinated. About 42% of Mobile County residents have received at least one vaccine. If a neighbor has COVID and their doors are open, can it travel next door? No, unless your two doors are within 6 feet of each other. So if you're, across the hallway in an apartment complex, then COVID can potentially travel from your apartment front door to the neighbor's apartment front door. But if you live in a single family home and, you have 3 to 5 feet, 3 to 4 feet easement, something like that is required, then COVID can't jump from your front door to your neighbor's front door. Why is it kindergarten and first grades are not made to wear a mask? So masks are recommended for anyone 2 and over, but in the school setting, I think it's second grade and older. And I think it just has to do with, children tolerating mask wear, needing to connect with their teachers, that sort of thing. It's a little tricky because we need children to be in school. We need them to interact and to feel safe with their teachers and caregivers. But wearing a mask is safer than not wearing a mask. Let's see. What benchmarks would schools be recommended to either return to virtual or close for a brief period? There are no hard benchmarks. We kept getting asked for this last year, and CDC, never came out and said, this is what we're going to do. What they have said is that you should consider 4 different benchmarks. So you should consider, are there localized outbreaks? Yes, there are. What is the number of new cases per 100,000 person over the last 14 days? So this speaks to community transmission. Right now, there are 1,734 cases of new cases of COVID per 100,000 persons in the last 14 days. What is the percent change in the amount of cases over the last 7 days? Is it going up or is it going down? And then what is the percent positive of laboratory tests? So we show this in figure 10 of our updated report. So you can see that 3 out of the 4 measures are all in the red, which means that things are pretty bad for schools right now. The only thing that's in the green is the percent change in the amount of new cases over the past 7 days, because we've had a slight dip in the number of cases. The last question on here is what percentage of hospitalized patients are 12 and under? And I don't know the answer to that, but I will get it and maybe bring that to you tomorrow. All right, so I think that's it for today. Again, a couple of things. Just remember, Pfizer FDA approved. Things are looking better, though they are still at alarming high levels compared to anything else we've seen. So please get vaccinated, continue, wear your mask, distance, stay at home if you're sick with COVID or if you have been exposed with someone with COVID. And we will talk again tomorrow at the same time in the same place. Have a great week, everyone.